we really need to work on the culture so that that is an inclusive environment for people to thrive, for people to spend their mental focus on their practice, on their research, on succeeding, and not on how to feel like they belong.
Well, good morning, everyone, and welcome to episode 5 in season 1 of our WInnovations webinar, now turned webcast podcast series. I'm your host, Kyle Richards. We have a really great session planned for this morning, and I'm really excited to introduce our guest here momentarily. I just wanted to say, though, that the purpose of these sessions is to highlight some of the really exciting and innovative work that's being done within our department here at the University of Wisconsin under the leadership of Dr. Stephen Nakata. We also want to generate a broader discussion within the entire urology community so that we can continue to work together to make innovative advancements in urologic care. Now, the format for today's session is going to be a 30-minute discussion. We're going to have some Q&A throughout. There's going to be really no slides, so not really a lecture-based format. Feel free, for those of you tuning in live, to enter any questions or comments in the chat at any time during the presentation. I'll be monitoring that closely. Now, our next podcast, I just want to share one slide. Our next podcast will be February 23rd, 7:15 to 7:45 in the morning. We'll be excited to have Dr. Frank Lin, who's an assistant professor, talking on innovative approaches to overactive bladder. Now I'd like to introduce my guest this morning, Dr. Shannon Cannon. Dr. Cannon joined our department in 2020, Shannon?
It was 2021, so not
Oh,
so long ago.
2021. I was close. With COVID, years get kind of blurred together. And she joined after completing her fellowship training at Seattle Children's Hospital in pediatric urology. In addition to her pediatric urology practice, she is the Director of Diversity, Equity, and Inclusion in our department and is very passionate about her topic today, which is titled Innovative Strategies to Promote Diversity and Inclusion in Urology, Metrics, and Moving the Needle with Numbers. Good morning, Shannon. Thanks for joining us.
Good morning. Thanks for having me. Really appreciate it.
Great. And like I said, if you have any comments, please feel free to chime in the chat. First off, Shannon, how did you get interested in DEI in the first place?
Yeah, so it's kind of been a growing passion over probably about the last decade or even more. So I was a medical student here at University of Wisconsin School of Medicine and Public Health, and as a second year resident or second year medical student, I was able to serve on the admissions committee here, and that was really my first opportunity to get a look at the processes of um, you know admissions to the medical field and being able to understand the considerations and really the limitations that we have for reviewing applicants for increasing diversity in our field of medicine broadly. And then when I was a resident, I went to a residency that had a research year, and in my research year, I served on the Graduate Medical Education Committee, which is a fairly large committee that helps to make some of the, I would say more important decisions about, broadly policies in graduate medical education in an institution. And I was able to be involved in a climate survey that was distributed across the entire GME. University of Washington is one of the largest GMEs in the country, so it was a really large survey, really to understand how residents and trainees felt supported and felt that their programs and the institution supported differences in race, gender, and a variety of other kind of metrics that are included when we think about diversity. And was able to take that data and then bring it back to chair people and program directors at respective departments. And having those conversations really impacted me in the sense that I saw some of the same barriers, obstacles, questions about how to go about making change. And that really inspired me to want to do more. And I think, knowing some of the, kind of obstacles that we have in urology, kind of nationwide as a profession, that together really, really drove my desire to be involved in this arena.
That's amazing, Shannon, how you got involved as a medical student and as a resident, and now as faculty member here in the department. We actually have a question that popped up, sort of a follow-up to that. Is you touched on it a little bit, but Dr. Nakata is asking, so what are the major roadblocks to achieving a less biased community?
Yeah, I mean, I think that, when we say, I think the biggest, kind of roadblock is a shift in culture and kind of how we view the medical profession or really the workplace here. Um, I really try to strive to separate the two words in the acronym DEI, diversity and inclusion. And I think that, diversity is important because, we see that there's a benefit to having a diversity of perspective, and people coming from different backgrounds bring that difference in perspective and help strengthen and kind of diversify the ability to move forward with approaches to, care, with approaches to research and so on. But I think inclusion is a really critical piece because if we work to increase, the numbers of women in a field that is traditionally male dominated or underrepresented in medicine, students or trainees, um, we really need to work on the culture so that that is an inclusive environment for people to thrive, for people to spend their mental focus on their practice, on their research, on succeeding, and not on how to feel like they belong in a space. And so I think that that inclusion piece is even in the programs as a resident, when I went to go speak with chairman and chair people and program directors, even in those spaces where they had made some gains in diversity, they were finding that next step of inclusivity being a very challenging component to success.
Yeah, it's very true, and separating those two out, I think, is a good way to think about it, because you can sort of address. There's different roadblocks probably at each level.
Exactly.
But along those lines, Shannon, how are we doing with diversity, equity, and inclusivity within urology as a field?
Yeah, and I think I start by saying we have some numbers and we don't have some numbers. So, these are all kind of how are we doing? There may be gestalt and then there can be measurements. And I think we have some measurements that help us understand how we're doing. And then we have some that have yet to be measured. And I think that's part of the innovation is figuring out how to measure those pieces. So when I say what we have as measurements, we have a annual census of urologists every year, the AUA census. And that's actually a sample, and they use that to extrapolate out to the, kind of the total population of practicing urologists in the United States. And, from a gender standpoint, we are seeing increases in the percentage of females in our field. So I think the last year, it was the first year it had reached about 10% female for the AUA census. That was, I think, actually the 2021 census, it was 10.3%. And that's taken a very long time. With regards to racial diversity, I think there's probably even less. So, when we consider populations that are historically considered underrepresented in medicine, Black urologists comprise about 3% of all practicing urologists, and Hispanic urologists are at about 4%. And so I think that those are areas that we need to continue working on. They are showing some increases, but they're very slow. In fact, there was a paper that recently came out, and there's been more than one paper that have demonstrated this, that, when we look at the rate of rise of female urologists, it would probably take about 50 years or even more to achieve parity, which, we have a large number of male patients, but we have a sizable number of female patients that we care for. We all have kidneys. So I think, that kind of demonstrates that there's a lot to be done in terms of increasing the speed of recruiting underrepresented folks to our field. With regards to, sorry, to finish out that question, inclusion is not really being measured or studied. And I think that that's a really, that's an emerging field in the field of medicine, to look at how we can measure whether or not people feel supported and that they feel like they're set up for success when they're in their workplace.
And then what about equity? As that you haven't really touched much on the
Yeah,
E part. How does
right.
that fit into the equation?
Yeah, and I think that that's actually a place where we have some more research, because I really find that that's a lot more geared towards patient care. So I do separate that out in my mind, and I think not everyone views it that way, but that's how I view it. But I think that we have some people across all spectrums of urology. So we have, several subspecialty groups that are, kind of, we see research coming out that looks at disparities in care, and that's in access, delivery, and outcomes. And I think that we have some good data that shows us that there is, disparities, and then how do we work towards improving those disparities in access, delivery, or outcomes. We're seeing more people become engaged in clinical trials that recruit underrepresented patients, because we don't have a lot of data on those patients in many respects, other than retrospective, large database populations. And so I think that that's a new area where people are trying to focus their efforts. In fact, one of our former fellows here from University of Wisconsin, Ashonda Estile, she's at Emory, currently trying to build a clinical trial practice that encourages recruitment of African American patients, which is great.
Yeah, wonderful. There's another question in the chats, which I think is sort of good to build on this discussion that we've been having. It's from Dr. Nakata, points out that there is now a diversity award at the AUA, as well as a standing committee. I was going to bring up too, the AUA had a DEI task force that did some great work, and fairly recently submitted a report to the AUA Board of Directors. So putting that all together, how does this help? And, is it enough? Maybe you could touch a little, there's a lot packed into that question. So we can maybe, you know, I do want to ask you a little bit about the task force, what they found and what their recommendations were. So I'll let you comment on pieces of that.
Yeah, I mean, I think that there are several efforts, both at the AUA level and at subspecialty levels, to make more acknowledgement of the need to increase diversity in our field, and to kind of work towards, to put more effort towards these issues. Um, I mean, I think that these are a start. I think that the AUA Diversity and Inclusion Task Force was then rolled into a committee, which I think, really importantly needs to have some, you know, um, initiatives and also financial backing for those initiatives. And I think that a scholarship is a good start. I think that there's several components of engaging with students at a earlier level, so that we start the process of creating relationships is really critical. And so scholarships are great with that. I think one or even a handful at a time is somewhat inefficient. I mean, I think that that's a good start, but I think there's, ways to reach out to students at kind of like maybe conferences that are geared towards medical students, um, reaching out to medical schools that have more students who are from backgrounds that are underrepresented in medicine, trying to create relationships that are longitudinal, create opportunities for mentorship and sponsorship. Those are, I think, really wonderful. And then that's at the front end, but I think at the other end of the spectrum, it's putting current urologists who are, from backgrounds that are really underrepresented in urology. So that includes women and, kind of Black, Hispanic, and kind of other multiracial people in positions to be leaders. And so in positions where when the decisions are being made at the top, they're being made with that diversity of perspective. And I think that that's really important.
Yeah, thanks, Shannon. That's well said. I want to switch gears just a little bit, and maybe we can talk a bit about the current landscape of DEI research, maybe in the broader sense, sort of globally, and then so two parts, and then maybe more specifically, anything that's going on the research front uh, regarding DEI and urology.
Sure. And I think this is again where you kind of have two areas of research. One is looking at the delivery of care or the kind of, how our patients are treated or how they fare in with regards to their disease processes. And I think that we have had for a really long time, as I said already, um, some large database driven evaluation of disparities. And I think that it's hard because that's really what we have in terms of trying to generate enough numbers, from a statistical standpoint to drive conclusions that seem to be robust. But I think the problem with that is we have a lot of granularity that we lose out on that those databases don't collect. So, health literacy, education level, and social networks. Basically, how do people navigate healthcare systems? How do they find their way to care? I think that that's an area where it's still a struggle to actually research, but more people are starting to look at health literacy at education level when um, when researching outcomes and actually trying to find ways of collecting that information, collecting that data. It's not available in some of our insurance-based or quality care, health care quality databases. But those are things that people are starting to recognize are really important if we're trying to understand how do disparities actually play out. With regards to looking at workforce issues, training issues, bringing in more people to our field, I think that more people are looking at kind of two prongs, and that's trying to actually have more data on who is in our field. And that starts with the census. The census has actually only been around for about 7 or 8 years in kind of a annual fashion. Um, and and really it doesn't collect data on who is applying to our field and who is not, you know, gaining admission to our field. Like, what are the characteristics of people who aren't matching, who's trying to get in and is not successful, and where can we target some of our efforts? We don't have that data, and it's not really easily accessible. So I think part of that is starting to understand what data we need to actually collect. And then finally, there's a lot of intervention-based research. So, and I don't mean intervention for people who are at risk, but really looking at how we change practices that change being the intervention. And then how does that affect our outcomes for recruitment? And so, one good example is University of Pennsylvania changed their entire recruitment process to include a more holistic review of applicants for residencies across most surgical fields. And they found that they matched a much more diverse um, uh, trainee population without any differences in like the traditional metrics that you'd use to measure excellence, like USMLE scores, grades, AOA status, and that sort of thing. So I think that, really there's opportunities to demonstrate that changing the way we recruit, evaluating what is important to us, what we want to see in our trainee and professional population, um, being able to show that those changes don't influence or detrimentally affect performance or excellence is really important. And that's a great place to continue researching.
Yeah, it's fantastic. Now, you mentioned the University of Pennsylvania model, I
Mhm.
think, which is fascinating and probably one of the more innovative strategies that I've heard of. But can you just expand upon that? Are there other sort of innovative things being done around around the country to try to work on these issues?
Yeah, so I think that, there have been a couple of um, programs that started mentorship, um, kind of mentorship networks, essentially, for medical students and residents who are, either interested in or, in urology training. And I think those are really great examples of grassroots organizations that saw a need and kind of um, created a space for something that was needed. So, Urator was, I think, out of UCSF, and that was really trying to match current urology residents with prospective urology residents, so medical students who are interested in the field, to help them work through the process of, making a strong application, understanding a little bit more about urology if they were kind of trying to feel out interest, and being able to make opportunities for, residents and medical students to connect, especially medical students who are maybe at programs that don't have a strong urology presence. I was the co-founder of a group called Urologists for Equity. This was really primarily trying to raise awareness for the needs for more DEI work, and that includes scholarship, that includes mentorship, that includes community engagement, and by community I mean the urologists community. So I think that that was a great example of a grassroots effort. And then finally, I think a lot of programs are seeing this important need and creating scholarships for visiting medical students who are doing their audition rotations, creating research positions for students, and then trying to actively review how they're recruiting applicants. And so I think those are good starts. But there's more to be done.
Yeah, and it's interesting. You have these cool, great programs like Uritor and other things popping up around the country, almost a little bit in silos.
Mhm.
So how do we implement these innovative approaches and then subsequently measure their efficacy in, sort of in a real world setting?
Yeah, I think, you know, really ideally, you want to be able to, unfortunately, we don't love surveys as kind of the basis of our of our research, but I think you need to actually ask the people who are coming through these programs um, how they feel that they help them or not. And I think that that's part of, what my kind of personal research passion is trying to understand from a qualitative and quantitative standpoint how are we doing with kind of the entire process, bringing people in, helping them to feel supported, and setting them up for success. Um, and so I think that at a bigger level, you have these different efforts, but I think putting it all together, we need to come up with a plan for how we actually reach out to the students. Um, Also looking at how they did, these are medical students, maybe not all of them match. Where did they go? What were the kind of, parts of their applications that were perceived as, you know, in a deficiency, or did they need more assistance with practicing for interviews? Those are the kinds of research that can be done, um, but has yet to be done. So I think those are good opportunities for improvement and innovation.
We've got a few minutes left. You and a group of others put together just a great paper in the Gold Journal a couple years ago. Can you just tell us what Urologists for Equity is, and there were some key points that came out of this paper, including four important pillars. So can you just walk us through that in the next few minutes?
Yeah, so I think the Urologist for Equity really, I think was just started by saying we need to do more. We need to um, push for acknowledgement that these are important things, uh, you know, in urology. We need to create opportunities for people who are interested in this work to have, um, you know, interactions with other like-minded individuals, people who are also interested. And so I think that there's, in any given department or even kind of, part of the country, there's, a handful of people who are really significantly devoted to this research and to this kind of these kinds of initiatives. And so to try to create opportunities for those people to connect with one another. And so I think that was kind of the primary driver for creation of Urologists for Equity. Um, so I think that when, I look at those pillars, we talk about like scholarship or research. And, that's really because historically, when we think about what urologists for equity or what like kind of urology has done in the past is that we haven't really done a lot of research into like created research that was truly data driven about this work. And so I think, what we need to do is we need to kind of create opportunities for research, and that's the scholarship piece. That's thinking about looking at um, when we go to AUA, uh, is there a section on diversity, equity, inclusion when we look at what we present at meetings and then what goes on to be published? That's what we care about as a field. And so that's part of promoting scholarship surrounding topics of, related to DEI. When you think about advocacy, that's, so the pillars, sorry to go back, the pillars are advocacy, sponsorship, scholarship, and engagement. And when we think about, advocacy, that's really trying to put people in positions so that they can succeed, so that they can advance in the field professionally. And that helps, create more representation. That also draws more people into our field to say um, we belong here. We, you belong here, and we want you to be part of our field if you're interested. And then when we think about um, sponsorship, that's putting people into relationships with other people who have power or who have networks that can say, I want to, I want to bring you in. I want to introduce you to others. I want to help you succeed. And so that was our goal, was to create a network of people who would be, interested in helping students, trainees, young faculty be, you know, in silos or a little bit more islands out in the world, kind of create some networks for sponsorship and advancement. Um, and then, finally engagement. And I think that's just trying to create a buzz about about this work and to keep it in everyone's conversation. And so that those are kind of the four pillars. And hopefully that, sorry to ramble a little bit, but
No, that's great. I think everybody should read this paper. It was in the Gold Journal, I think published in 2021. If you need it, you can email me. I can send it to you. It's a great paper. There's also a group called the Pink Trigones, which I didn't know about.
yes.
So I learned a lot from reading it, and it's great work, Shannon. Lastly, how can our viewers, our listeners, anybody, how can we get involved?
Yeah, so I mean, certainly through Urologists for Equity, you can sign up and then there's a form to fill out. But I think the most important thing is really getting involved wherever you are, trying to understand what's going on at your institution. And if it's nothing, what there's a lot to do. There's a lot of space to create initiatives. You know, really the sky's the limit. We have the opportunity to create programs and try to bring people in. And then also, thinking on a very individual level, like looking for opportunities to think about your patients, think about how they receive care, think about how you interact with, if you're in an academic setting, residents and medical students. And potentially even undergraduates, how can you create those sponsorship opportunities, create those mentorship opportunities, think about how you might want to get involved with research that's going on. I'd be happy to talk with anyone, after this who's interested in, research in DEI, and I'd be happy to talk with them about programs too. This is, obviously my passion, so I'd always happy to talk.
Well, thanks again, Dr. Cannon. It really has been a pleasure having you on our podcast series, WInnovations. Special thanks to the department, Dr. Nakata for his support. And this has just been a great discussion. We could talk all day, I feel like, but it's time to go. And I look forward to seeing everybody in February for Dr. Frank Lin giving us some innovative updates in overactive bladder. And we'll be signing off here, and I hope everyone has a good rest of their day. Thanks
Thank you.
again. See ya.
Bye.
WInnovations is a production from the Department of Urology at the University of Wisconsin-Madison School of Medicine and Public Health. Thanks for listening.